hearing loss. Sensory neural hearing loss with a recurrent episode of vertigo. So there is disturbance. Okay, so whether it is a Pendant syndrome, Usher syndrome, Alpert syndrome, or Perrault syndrome, what is that syndrome, guys? So, what is the Alpert syndrome? So, Alpert syndrome you must have read in pediatrics. It is also having a triad. It is a genetic disorder which is caused by the mutation of type 4 collagen genes. So, Alport syndrome is a genetic mutation in the type 4 collagen gene which leads to defective collagen in the kidneys, ears, and eyes. It causes persistent blood in urine, which can cause hematuria and progressive kidney damage, high frequency hearing loss, and eye abnormalities. Medications, dialysis, and transplants can be used. So, hematuria is the clinical feature of Alport syndrome. There is a hearing loss, which is sensory neural hearing loss. It occurs due to inner ear defects. The sensory neural hearing loss, it occurs due to inner ear defects. Typically, it starts in childhood and it progresses in the adults or adolescence also it can start. This anterior lenticonus because the shape of the lens is not proper. So in the eyes they can have anterior lenticonus. Lenticonus. Okay, so misshapen the lens because type 4 collagen is defective. How will you remember? Alport is type 4 collagen. So remember Alport. So this spot is having four, right? PORT, four letters. So remember Alport is collagen 4. Okay, collagen 4. Collagen 4. So you can remember four things are involved. What are that? There is a genetic mutation. You have to remember point genetic mutation in type 4 collagen. Second point, sensory neural hearing loss, and the most important kidney issues, which is having hematuria, blood hematuria, sensory neural hearing loss, and there is the anterior lenticonus, which is the misshapen of the lens, and dot and fleck retinopathy, which cause a visual impairment. Dot and fleck retinopathy. Fleck retinopathy is there because there is a defective collagen. So it is a X-linked autosomal recessive or it can be autosomal dominant. So having a family history is the primary risk. With the males often experiencing more severe symptoms such as earlier end-stage renal disease. Diagnosis is done by confirming through genetic testing, kidney biopsies, looking for type 4 collagen changes, and sometimes skin biopsies. There is a no cure because it is a mutation. So there is a medication ACE inhibitors or ARBs used to control blood pressure and reduce proteinuria, which can delay renal failure. So kidney failure management is dialysis and kidney transplants are required for advanced chronic kidney diseases. So most males with S-linked Alport syndrome develop kidney failure and stage renal disease by age 40, whereas females often have a milder course. Early diagnosis management will help them improve and have better prognosis. So dot and fleck retinopathy, anterior lenticonus, Alport glomerular basement membrane. Alport syndrome is having glomerular basement membrane thickening or thinning. Okay. So this is Alport syndrome, all about Alport syndrome. There is a triad of Alport syndrome. So what is the triad? The triad is nephritis, which is having inflammation, and when we talk about itis, when we talk about itis, inflammation. We talk about itis, inflammation, nephritis, inflammation of the nephrons. Then what happens here? There is a hematuria more than proteinuria, and so that's it's distinctive from nephrotic because more of blood, whereas in nephrotic there is more of um, proteins. So nephritic syndrome, and it has proteins also, hypertension, and chronic kidney disease. Sensorineural hearing loss, typically bilateral and high frequency. This loss is caused by structural defects in cochlea's membrane. Okay, and there is the sensorineural hearing loss, and there is ocular abnormalities. Common findings include anterior lenticonus, a protrusion of the lens, macular flex, and corneal erosions can be seen. And because there is a type 4 defect in all about the Alport syndrome, female can be affected. If males affected, they are severely affected. Okay, if we compare to females. So there are two types: autosomal recessive Alport syndrome and autosomal dominant Alport syndrome. So recessive, both males and female with this form typically develop kidney failure before age 20, whereas for dominant patient usually have a average lifespan. So this was all about Alport syndrome. So Alport syndrome is basically having lenticonus, sensorineural hearing loss, and nephritis. Okay, it has type 4 collagen defect. So it is having so let's summarize about Alport syndrome, summarize each and everything. So first thing is, what is Alport syndrome? So Alport syndrome is a genetic disease which